Welcome to Shop Talk with Kansas City Joint Replacement. I'm Dr. David Anderson, and joining me today is Dr. Suhel Kotwal. Dr. Kotwal brings a very precise breadth of knowledge to our practice and quite a bit of training as well. And that's one thing I want to talk to you about today is kind of expand on what fellowships you've done. For people who don't know, a fellowship is an extra year of training that surgeons and any physician can do, but in our case, surgeons do an orthopedic surgery to specialize. And you've not done just one, but three. And if you could tell me kind of what those three were and what that brings to our practice.
Hi, Dr. Anderson. Thanks for having me here. I did 3 fellowships after my orthopedic residency, and it was very fruitful and educational, and I guess helpful in the treatment of complex patients like joint replacement and spine. But I also went ahead and did orthopedic oncology.
So let's hold on a second. So we've got joint replacements, so arthroplasty and adult reconstruction, because you're being humble right now. You did a spine fellowship with an extra year specializing in complex spine reconstructions and treatment of spine disorders, and also musculoskeletal oncology, which is an incredible breadth of knowledge and requires a lot of academics and surgical skill to do that. So you're being humble when you describe those, but for the crowd, that's kind of what his training is.
Thank you for saying that. I was always interested in complex problems like bone and soft tissue tumors, including pelvis, extremities, and the spine. And orthopedic oncology was one of the ways of achieving that kind of knowledge. It was very gratifying to go through that year and take care of patients who require help. It is a specialty that gets ignored, and there's not many doctors who do that. Hence, it was a no-brainer for me to go in that and serve the population.
And it's a tough subspecialty to go into, but we have really great resources here with the Sarah Cannon Cancer Center. And so you've really been able to kind of couple your practice as you come on board with us here and work with them, and even some research projects that are in the works now as well, to make life better for patients who have very complex musculoskeletal tumors. And so that's exciting stuff for the system and for our patients in Johnson County.
Yeah. This is an excellent platform to practice orthopedic oncology with our association with Sarah Cannon Cancer Center. We have access to labs and research technologies and also modern day implants to perform all these complex procedures with great outcome.
And what most people don't know is not just your 3-year-long fellowships. You also, right after you joined us, you went on a very distinct and honorable mini fellowship, traveling around the country to some of the big centers in the country, learning from some of the masters of the craft. Mm-hmm. And so that was really exciting as you came on with us to kind of go get that, especially during the pandemic, get this hands-on knowledge with some of the people that are really the leaders in the field, which we're excited about.
I was very fortunate to be selected by the Hip Society to visit top 10 centers of the US and the Canada to watch and observe and learn and share our experience with hip-related surgery and reconstruction, and that was an amazing experience for me.
And again, it brings a lot to our patients here in Overland Park, Kansas, and from the surrounding areas. And Dr. Kotwal, we're so happy to have you join us. And that's all we have time for right now, but thank you for watching this. If you'd like to get more information or have a consult with Dr. Kotwal or any of the surgeons in our practice, you can reach out to us through the Monroe Medical website. There'll be information available at Kansas City Joint Replacement and Sports Medicine.
Thank you, Dr. Anderson.
Thank you.